Bismillah ar-Rahman ar-Rahim. International Standards for Tuberculosis Care. Standards for diagnosis. Standard 1 TB suspect. All persons with otherwise unexplained productive cough lasting 2 to 3 weeks or more should be evaluated for tuberculosis. Standard 2 suspect management. All patients suspected of having pulmonary TB should have at least 2 sputum specimens submitted for microscopic examination in a quality assured lab. When possible, at least one early morning specimen should be obtained. Standard 3 extrapulmonary tuberculosis. For all patients suspected of having extrapulmonary TB, appropriate specimens from the suspected sites of involvement should be obtained for microscopy, culture, and histopathological examination. Standard 4 chest radiograph findings. All persons with chest radiographic findings suggestive of TB should have a sputum specimen submitted for microbiological examination. Standard 5 sputum smear negative pulmonary tuberculosis. The diagnosis of sputum smear negative pulmonary TB should be based on the following criteria: at least 2 negative sputum smears, including at least one early morning specimen, chest radiograph findings consistent with tuberculosis, and lack of response to a trial of broad-spectrum antimicrobial agents. Standard 6 childhood TB. In all children suspected of having intrathoracic TB, bacteriological confirmation should be sought through examination of sputum for smear microscopy and culture. In the event of negative bacteriological results, a diagnosis of tuberculosis should be based on the presence of abnormalities consistent with tuberculosis on chest radiography, a history of exposure to an infectious case, evidence of tuberculosis infection, such as positive tuberculin skin test or interferon gamma release assay, and clinical findings suggestive of tuberculosis. For children suspected of having extrapulmonary TB, appropriate specimens from the suspected sites should be obtained for microscopy and for culture and histopathological examination. Now we finish the standards for diagnosis. The standards for treatment will be in the next video or another video. And note better that these standards are from International Standards for Tuberculosis Care, ISTC, second edition.